And welcome to everyone. I'm Ann Hesse, and I lead the Democrats Abroad Global Women's Caucus. So good morning, good afternoon, and good evening to our distinguished guest speakers, to our Democrats Abroad members, and to all of you who have taken the time to join this call from around the world. We welcome you to today's discussion, The Fall of Roe. For those of you who aren't familiar with us, Democrats Abroad is the largest organization of U.S. citizens outside of the United States. We're also an official arm of the Democratic Party. It's our mission to provide Americans abroad with a voice in our government and to elect Democratic candidates by mobilizing the overseas vote. As part of that effort, we'll be having volunteers from our voters assistance team standing by at the end of this event in a separate Zoom room to individually answer questions you might have about this process. The Women's Caucus is the largest of the Democrats Abroad constituency groups. Our teams focus on many issues of concern to women, including equality, violence against women, economic empowerment, and more. Well, reproductive justice has always been at the very top of our priority list. It's never been easy, and there have been setbacks. The assault on Roe has pushed women in the US back 50 years. Women have fewer rights now than they did decades ago. But despite the setbacks, there are some bright spots on the horizon and reason. Recent victories where nationwide polls show us Democrats can fight for abortion rights and win, even among independents and Republicans. The surge in women registering to vote is also encouraging. Reproductive freedom is sure to be a major mobilizing factor among voters in every district, in every state this fall. Fortunately, our GWC reproductive justice team led by Sally Schwartz is ready for action. Under her guidance, this team has grown into a powerful activist force, educating and mobilizing concerned Americans around the world. Sally has a Paris-based international for over 40 years, former GWC co-chair. She serves on the GWC committee and leads the Reproductive Justice Action Team. Generously agreed to be moderator today and will introduce our panel. Also co-hosting today is Angela Fobbs, the founder and former chair of the Global Black Caucus and DA Germany Wiesbaden chair. She serves in other capacities, including the Global Women's Caucus Steering Team, the DA Environment and Climate Crisis Council, and the IT team. She'll be good. Questions for our guests from the chat box, Zoom, and on Facebook, where we're live now. So you're welcome to type in your questions as we go. Now I'll hand off to Sally, who will lead our discussion.
Thank you, Anne, and thank you for all the work you've been doing on behalf of the women's cause in the United States. I head the reproductive justice team, which is one of 10 active teams in the DA Global Women's Caucus. And unfortunately, my team has had the limelight because of everything that's going on and has gotten worse since Dobbs. We are very active, and if you want to join us, we can tell you how to do that at the end of the call. Lately, we've been doing Twitter storms to get Senate votes on the Women's Health Protective Act, new campaigns on the Dobbs decision, and the most important thing is encouraging people to vote. I want to, before I get to our panelists, I want to do a real great shout out for Connie Board, who's also on this call. Connie has been an activist in DA and a feminist her entire life. I'm not going to tell you how long that is. I want to personally and professionally thank Connie for all she has done and continues to do for Democrats Abroad and more generally for women's rights. She is solely responsible for arranging this webinar after she had the honor and pleasure of meeting both Andrea and Dawn in person this summer. So thank you from the bottom of my heart, Connie. Our two panelists today are Andrea Miller and Dawn Porter. Andrea is the president of the National Institute for Reproductive Health and its Action Fund, which is an advocacy organization that fights for just and equitable access to reproductive health care in states and cities nationwide. She is a nationally recognized expert in reproductive health rights and justice, and her leadership in this field stretches back to helping to found the Center for Reproductive Rights. Before taking the helm at the National Institute for Reproductive Health about a decade ago, she served in the leadership of and as a consultant to a host of nonprofit advocacy and philanthropic organizations. Andrea has a Master of Public Administration from the Kennedy School of Government at Harvard and a Bachelor of Arts in Political Science from Columbia College and Columbia University. Welcome, Andrea. Our next speaker will be Dawn Porter, who is an award-winning filmmaker whose 2013 documentary, Gideon's Army, won the Sundance Film Festival Editing Award, the Tribeca All Access Creative Promise Award, and was nominated for an Independent Spirit Award and an Emmy. Dawn's other films include Spies of Mississippi and Rise, The Promise of My Brother's Keeper, a documentary chronicling President Obama's program to help young boys and men of color succeed. Dawn's third film, which she wrote, directed, and produced, which is called Trapped, premiered at the Sundance Film Festival in 2016. It shows the impact of anti-abortion laws on abortion providers in the South, along with chronicling the last remaining abortion clinic in Mississippi. Dawn has said that she decided it was her duty to make this film after witnessing that there was only one abortion clinic in the entire state of Mississippi. Alas, no longer. The title of the documentary was derived from the term TRAP laws, which stand for Targeted Regulation of Abortion Providers. The TRAP laws have led to the closure of hundreds of southern states' clinics, mostly in areas that serve as poor women and women of color. TRAP goes to the front lines of the controversial battle over the right to abortion, which I may add has only gotten worse since the Scottish decision in Dobbs. Let's watch the trailer of TRAP now, and then Andrea and Dawn will talk to us about the current situation in the United States. Angela?
In Texas today, Governor Rick Perry signed
In
some
Alabama,
of the nation's toughest.
Mississippi could soon begin the fight to eliminate abortion.
Women are going to have abortions. It's just that they are not going to be safe and legal.
The legislature passed a bill that they knew that we could not comply with. And that was the function of the bill. The function is a trap.
In the past 3 years, there have been hundreds of restrictions passed, more than in the past decade.
These rules don't add anything to the safety of women.
This is our pharmacy. The drugs always expire because we never use them. I don't know that we've ever used any of these things in this clinic ever.
They chop away piecemeal at reproductive rights.
There's a 2 or 3 week waiting list for a procedure where time is of the essence.
I remember getting a call once from a patient. She said, "What if I tell you what I have in my kitchen cabinet and you tell me what I can do?"
We've forgotten what this country is about. Dignity is given of God.
I have a hard time forgiving myself.
I want women to talk to each other, to quit shaming each other. I want people to quit shaming women over abortion, period.
I'm on the floor today to give voice to thousands of Texans who have been ignored.
The Supreme Court is going to hear another one of these cases, and it's going to be a showdown.
They're letting politics trump medicine.
You should understand it's not going to happen without a fight.
It is escalating what is happening across the United States.
It's increasingly becoming the case that women's constitutional rights are determined by their zip codes.
I just want more people to start asking who's benefiting. Who benefits?
Gives you chills, doesn't it? Let's now hear from Dawn about her wonderful documentary and what she has to say about it a couple of years, maybe 5, in fact, later. Dawn?
Yeah, thank you so much for having me. It was such a joy to connect with Connie this summer and to learn about the wonderful work that you all are doing, which is so important. I can't I can't overstate the importance of the work of this organization. I was in Mississippi in 2013. I just finished my first film. I was working on my second film. And I read in the local paper that there was one abortion clinic in the entire state. And I was shocked by that. I consider myself pro-choice and politically active and politically aware. And I thought, if I'm a person who reads the papers and follows this issue, I thought closely, and I don't know that there's only one abortion clinic in the entire state of Mississippi. I bet a lot of other people don't know that either. And I was just really curious about what was happening in the state, that essentially the state government could regulate all of the other clinics out of existence. And so I approached the clinic and the doctor who was working there, who you see in the trailer, Dr. Parker, and he at the time was living in Chicago. He was working in Chicago, but he was getting increasingly frantic calls from clinics in the South where there were no providers, no local providers were willing to provide abortions. And so he was flying on vacations and weekends to Alabama and Mississippi and a few other states. And sometimes he would be one of a handful, if not the only provider. And so I thought that we should follow this, that this was really, it was more than the canary in the coal mine. It was just an untenable situation that was taking place in front of our eyes. The right to abortion, Roe doesn't matter, legal abortion doesn't matter if there are no clinics and no doctors. And that was, at the time, that was the strategy of the anti-choice groups. It was to regulate these clinics out of business because they couldn't overturn Roe. They did not have the Supreme Court at that time. And so for 3 years, I followed Dr. Parker in Alabama, primarily in Alabama, 3 Alabama clinics where he was working to try and save abortion in that state. And so at the time, you'll see Nancy Northup, who's the head of the Center for Reproductive Rights, which is it's a nonprofit law firm that has largely been at the forefront of litigating all of the cases, or majority of the cases, about reproductive access in the United States. And they were fighting court cases across the country. That same firm argued the case in the Supreme Court, Dobbs, but they also have argued the other abortion cases. And they were quite clear that stopping the regulations would be essentially a speed bump. I think there was not any doubt that the anti-choice groups would continue to try and overturn Roe. So as a filmmaker and as a citizen, I felt like I was in, through the looking glass, that people weren't paying attention to the idea that abortion was being eviscerated right before our eyes. We were literally living through that. So people who are shocked by the Dobbs decision, who thought Roe could never be overturned, I think it's because the attacks on abortion were kind of stealth attacks, and now they are just out in the open. One other thing I want to say before, kind of turning to Andrea and her assessment of the status of reproductive rights, of abortion care. It's really important that you say abortion, that we not allow the stigma of a healthcare procedure to prevent us from talking about it. That, I think, is part of why we are in this situation, because we have been silenced about talking about something that's so important. 1 out of 3 American women will have an abortion for one reason or another. And to not have this procedure be available to them is more than angering, it's frightening. So the the statutory approach to regulating abortion is very similar to the conservative and largely religious and political effort to regulate other rights. And so we see the same groups now turning their attention. This effort will not stop at outlawing abortion. Justice Clarence Thomas clearly provided a roadmap to also outlawing IVF and contraception. And that's where we are today in the United States. And so for people who think that it is impossible that those healthcare facilities could be outlawed, I would suggest that they're wrong. So.
Andrea, would you like to pick up that hot potato?
Absolutely, absolutely. Well, first of all, I just want to thank Democrats Abroad and Anne and Angela and Connie and Sally. It was so wonderful to meet you, Connie, and Dawn. It's always such a pleasure and such a privilege to be in community with you as a speaker. So just to give you some landscape of sort of where we were before Dobbs, as Dawn mentioned, by the time the Dobbs decision came down, we had over the course of the nearly 50 years since Roe, state legislatures in particular. I mean, I think that's one thing to start with, is to understand that people have talked about abortion rights and abortion access as a Supreme Court matter, as a federal matter. And it is true that the Supreme Court, up until very recently, set the floor, meaning that they said that states could not ban abortion prior to the point of viability unless they included exceptions. And even after that, they had to include exceptions to protect the life or health of the woman or anyone who was pregnant. Now, we always knew, and this is why the National Institute for Reproductive Health does its work, that the fact is that the ability to have the right and the capability, the accessibility of access to abortion care has always sort of begun and ended at the state level. The reality is that Roe versus Wade, which was just overturned in Dobbs versus Jackson Women's Health Organization, was a case out of Texas that was a challenge, legal challenge, to a Texas abortion ban. And in fact, most states had bans on abortion dating back to the mid-1800s, when frankly, the male medical establishment tried to eliminate the ability of women and their midwives and healers and others to help regulate pregnancy and be able to prevent pregnancy. So there were a lot of states that had those on the books. When Roe versus Wade was decided in 1973, it said all of those bans are now invalid, or at least they need to be became dormant. And they sort of set the floor. But the work that we have done at the National Institute for Reproductive Health is always to say, we know that you cannot rely forever on the Supreme Court. There was a reference to the Center for Reproductive Rights, which I was a founder of. And the fact is that in the late 80s and early 90s, we had a Supreme Court that was ready to overturn Roe. So for my entire professional career working on this, that has been a reality, that could happen and we needed to be ready for it. And the way to be ready for that, and let me give you some statistics, is to do the work at the state and local level where really we can make a difference. Prior to Roe versus Wade, there were 2 states on the mainland that had liberalized their abortion laws. Today, we have 17 states and the District of Columbia, and more than half of them did that just in the last 3 years. That's the kind of work that we do. So rather than Roe being rolled back and seeing that we had states with bans from the 1800s or newer bans that have been passed since Roe in anticipation of an overturn, we now have 17 states plus DC. That's a really critical bulwark. And there's tremendous work that we're doing at the city level too, which I'm happy to share. But so here's the juxtaposition. Today, you have to look every day, sometimes more than every day. We have now 14 states that have banned abortion just in the 2.5 months since the Supreme Court overturned Roe versus Wade. There are lawsuits going on, challenging both directions. There's a lot of chaos. The reality is that 1 in 3 women in this country now live in a state where abortion is banned. That is a fact. And we will see, unfortunately, more states come online doing that. So that means just tremendous challenge and is just absolutely heartbreaking. I mean, what Dawn alluded to in terms of what she found in her film, who was most impacted, who was most harmed by attempts to, at the time, regulate abortion out of existence, and now basically ban it entirely through the laws and allow for that threat of prosecution to prevent people from providing this care or accessing this care. The reality is that we are seeing so many people unable to get abortion care when they need it in their communities, in their home states. And it is predominantly those without financial resources. It is predominantly Black, Indigenous, Native, Latinx, and other people of color. That is who is most impacted by these abortion bans. And I will just say one last thing, and then I'm happy to say more about sort of what is happening now and what the future could be, because I think that's really important. But it means that for those who live in the states where abortion is banned, they really have three options. One option is to travel to a state where it is legal and accessible, and increasingly there's more investment to make that possible. That is obviously exceedingly difficult, especially if you're in one of the southeastern states where you have to go really, really far in order to find a state where abortion is not only legal but accessible. And in fact, in states where it's legal and accessible, the waiting times for those appointments are now weeks, if not months, because so many more people need them. The second option, unfortunately, is to remain pregnant, right? And we're already hearing that these abortion bans are preventing healthcare providers even from providing health and life-saving pregnancy care for people who have wanted to continue their pregnancies. Our crisis in maternal mortality and morbidity in this country is abysmal, and it's only going to get worse because of that. The third option is, thankfully, the other difference before Roe versus now is that we have medication abortion, and it is far more widespread. It now accounts for, these are pills that can be taken safely and effectively to terminate an early pregnancy. And they now account for, in advance of Dobbs, more than half of the abortions in this country. And it is possible to manage an abortion yourself in your community with people who you know and trust. It is just as safe to do that if you have the right pills and the information as it is to go to a clinic and do it there. So that is an option, although the fear and the concern is that you risk criminal prosecution, either for doing that yourself or for someone helping you. So those are the realities of what's happening in the states where abortion is currently banned. That's the downside. That's the doom and gloom. I want to pause and give Dawn a chance to come back in. And then I was going to come back and talk about some of what can we do about this? What comes next?
Yeah. You know, I think if there's, we've both laid out the very sobering current status of abortion rights, you know, in America. One thing that has been, I don't want to say it's a surprise, but it's been a pleasant circumstance and an encouraging circumstance is the activity on behalf of primarily women who are registering to vote and who are combating this effort to take away their health care, their personal private decisions about their lives and their welfare. That is driven in part by anger and shock that abortion remains overwhelmingly supported by the majority of Americans. Those numbers have only increased. It's something like 2/3 of Americans support abortion rights. And so that is now being reflected in voter registration activity. The other thing that is happening is more people are willing to talk about their experiences. And while I find it heartbreaking that any person, any family should have to share their private medical experiences, I'm very grateful to the people who are sharing those experiences. So, for example, we have women who are miscarrying, where the miscarriage is not complete. And so the standard treatment for that is a D&C. I will tell you that this is something that happened to me. I had a miscarriage that did not complete. I had to have a D&C. This was a very wanted pregnancy, But I realized I am one of the people who's had an abortion because I needed that care. And thankfully for me, I was able to do that. More women are explaining that. What is happening though, which is very, very serious, is physicians are so afraid of legal liability that they are on the phone with lawyers to determine at what point are they legally clear to perform sometimes life-saving procedures for pregnancies that should not be carried to term. So we're hearing a lot more conversation about the reality of this healthcare circumstance. And I think that is positive. I have definitely found in the work that I've done that once you activate a community, they don't go back to silence. And so if it's the case that largely women, but also I think many other groups were a great silent majority, I think we're seeing people are not silent anymore. And so I would just encourage all of you, wherever you are, to become part of that vocal majority, because that's what we are. And when we think about what we're proud of about this country, and there are still some things, one of them is our ability to freely express our opinions and our desires. And so if there's any silver lining to this really serious, sobering circumstance, it's that people are finding their voices and they're finding their power. And you can't put that genie back into the bottle. And so we're hoping that is going to translate into some more permanent, lasting protections for the civil liberties that every person should enjoy in this country.
Thank you, Dawn, for that uplifting message, because I admit that it's pretty gloomy and doomy from where we're sitting. But Andrea, do you want to come back on and tell us what you're doing, what your organization is doing, and what we can be doing as Democrats abroad and very loud American women, how to move this forward? Thank you.
Absolutely. I think, Dawn, you made the perfect segue to what I was going to say, and that is that one of the other things that we have seen is, as I said, we at National Institute for Reproductive Health for the last decade, we've been focused on trying to move the ball forward, to find those ways at the state and local level to both safeguard reproductive rights, like in those 17 states plus the District of Columbia, and to expand accessibility, to make sure it's not just a right, but a reality. So that means removing existing barriers for young people and for low-income people. It means ensuring that there's Medicaid coverage, so that if you are eligible for that particular health insurance because of your income being lower, you can also have an abortion, even though the federal Hyde Amendment prevents the federal government from covering abortions. So looking at those ways to move the ball forward. For a long time, we had to convince people that this was worth doing. They're like, yeah, but we've got the Supreme Court, we've got Roe versus Wade. Why are you making us do all this hard work at the states? And we said, because you can't guarantee that that's going to be there forever. And because what the Supreme Court said wasn't how it should be, it was, you can't go below this standard. So we said, why not look at how you could make it more accessible, how you could start to destigmatize, how you could make sure that people are able to access the care that they need. And needless to say, one of the really powerful things that we have seen, and this is where the power of voters comes in so much, is that as it became clearer and clearer that we were going to lose this case, we saw elected officials really start to stand up. We saw votes in the U.S. House of Representatives and the Senate on the Women's Health Protection Act. Even though it didn't pass in the Senate, it was the first time you had seen an abortion vote on the floor of the Senate and on the House, although the House had been doing it for a couple of years, in decades, frankly. That's a huge step forward. What we need to change there is we need a better Senate so that it isn't so tight and so close. And we need, frankly, to be clear that this is not just about your party affiliation, it's about what your values are. Because we have, and I've experienced this at the state level in places like New York and Massachusetts that had super majorities of Democrats and they wouldn't move an affirmative abortion law forward until very, very recently. So we have to be really clear that we need to vote on this issue, and we need to clarify and be explicit about what our expectations are. Right now, we're seeing a lot. I happen to live in and vote in a congressional district that everyone was touting because it was a special election for a congressional district in New York, CD 19, where a Democrat won a really tight race that was not expected to be a winner and ran on the abortion issue. So more power to him. He ran on the abortion issue. But what he said was mostly, I'm not that other guy who's going to ban abortion. So we need to say, that's great. You got to run on making sure that you are not that person. But what are you going to do when you get into office? That has to be part of our call to action right now is we're going to vote for you if you say you're going to do the right thing, not just not do the wrong thing. But the other thing that we've seen that's been so powerful is what's happening in the states. We had multiple states even before Dobbs putting money into the pot, saying we're going to expand the infrastructure in our state because we know in places like New York and Massachusetts and California and Illinois that we're going to have more people coming here. So we need to fund those services to a higher degree. And we've also seen them set aside money for travel expenses, for childcare and lodging. And you have to remember more than half of people who have abortions are already parents. So when they're thinking about trying to travel, they're also thinking about, what do I do with my kids? How do I make sure that I can get there? How can they be taken care of? And they're also setting aside money for the abortions themselves. So that's a huge thing that we're seeing in there. We had been working on that for years. We had a few states that have been doing it, but now exponentially more are doing so because it's been really clear to these elected officials, they need to step up now. Not being the bad guy on this is not good enough. You got to be good on this.
Right.
You got to do the work. And I think it's really important to know that while I've just named a bunch of blue states, that the work we're doing at the local level, which, and I will say, I encourage all of you, if you don't know right now where you can vote, find out if you can vote at the federal level, find out if you can vote at the state level, find out if you can vote in municipal elections, because all of those matter, every single one of them. Let me give you an example. Since Dobbs, so 2.5 months, well, before Dobbs, we had 3 cities that we had managed to get to fund either abortion specifically or the practical supports like lodging and travel and transportation. That was over the course of 3 years prior to Dobbs. Since Dobbs, less than 3 months, 10 cities. And I'm not just talking about the Chicagos and the New Yorks and the San Franciscos and the LAs, although they are among them. I'm also talking about cities like, I kid you not, Atlanta, Austin, St. Louis, and where else am I? And there's also at Columbus, Ohio, Philadelphia, Pennsylvania. So these are cities in redder and purpler states that are saying, we're going to fund abortion care. We're going to fund practical support. We're going to make sure if people need to come here for abortions, they can do so. And many cities have also said, we are in these states that are banning, we're telling our police departments, our law enforcement, don't participate in the enforcement of these laws. We're saying make it the lowest priority for your police department. And that's places like Austin and Denton, Texas. It's New Orleans, it's Atlanta. These are places that they are able to stand up right now. And what's important is for them to know this is what's expected of you, and the voters will have your backs. So that's my message is we are seeing so much energy. Now, yes, would it have been nice if they'd been there 5 years ago so we weren't in this place? Sure. The fact that there's that motivation, and that motivation is directly related to knowing the harm that Dawn was describing and the power of voters in this moment. And it's not going away. It's not sliding. It's not slowing down. And I'll just end with my other note of 2 other notes. There are several states where the governor's races will determine if abortion remains legal in those states. Pennsylvania, Wisconsin, Michigan, absolutely, hands down, that is the defining factor right now. Several other states need to get new governors. Georgia, Texas, places where it would make a huge difference, even though they've already banned. And finally, when this goes to the voters, they turn out. Kansas, 2-1, defeated an effort to say that their state constitution couldn't protect abortion. That says a lot. And there's going to be ballot initiatives in Michigan that could protect abortion rights. And there's huge energy there. The last thing I'll say about that is in the history of Michigan as a state, the number of signatures that were collected to support this ballot initiative in Michigan to protect abortion rights this fall was more than had ever been collected for any single ballot initiative ever in Michigan. So we have power as voters. I really that cannot understand.
This is good news. This is good news. Thank you, Andrea. I always like to not end, but at least leave it for the moment on a positive note. Let me get the ball rolling. We have 3 questions in the queue, but let me ask you and Dawn one question. As DA members living abroad, and in addition to registering and voting, how can we help? You know, we know we have to get the vote out. But do you need us on the ground? Should we be asking our younger members who come and go because they're students? Should we tell them to get in touch with whoever you tell us to get in touch with? Should we be in the streets right now? I don't know. I mean, what advice can you give people that are living abroad? Because you know this, but I'll just recall it for whoever's listening. Most of us, not all, but most of us live in countries where this is not a problem. So we're very blessed in that sense, other than the fact that some of us are so old that it probably doesn't matter, but we do have daughters. So tell us, what can we do to help the situation? I don't know which one of you wants to go first.
I mean,
Dawn,
I'll start. We have seen increasingly, and this also speaks to one of the questions in the chat, that there's suspicion about polling. It has been so unreliable in the past several elections. And what that means is people will read polls with a grain of salt. And so what is very effective is chatter, is people looking to social media, looking for expressions of support, looking, so no matter where you live, if you are an American, any place in the world, saying, we see you, we see what's happening, pointing out the absurdity and the fact that America is very quickly descending into the same situation as some, economically, stressed countries.
Developing nations. Yeah,
that's right. We are maternal mortality, as Andrea said, is only going to increase. So the chatter is really important. Expressions of support. The politicians are watching, and particularly those places in purple states. So for purple states, it's important to say, we're watching you, and this is how we're going to vote. For the blue states, it's important to say, just as Andrea pointed out, it's not enough for you to be like, I'm not terrible. You have to be good. You have to earn our vote. But the other thing to think about is this issue, while it's a single issue getting people to the polls, they vote a straight ticket once they're there. And that we hope will see results in down ballot elections as well. So that's really important. And then I want to address the question about whether or not.
Sorry, Dawn, I'm really apologetic. I don't mean to interrupt you, but the people that are listening in can't necessarily see the Q&A. So Angela, do you want to just read the question, or Dawn, do you want to read it? Angela?
Yeah, I can read the question.
I'm sorry, but
that's okay.
That's okay.
Yeah.
That's okay. It's a question from Stephanie Wallach. She says, something that greatly concerns me is that women who have had a miscarriage and need care for miscarriage can be accused / suspected of inducing abortions and be refused care. Is this something that should be seen already, or should we be bracing ourselves and organizing around it?
It's such an important question. I will say that unfortunately, even before the fall of Roe, we were seeing women be prosecuted. And again, it was predominantly lower income women, those with fewer resources, it was predominantly women of color. who were being prosecuted, usually for self-managing abortion, but also for miscarrying, and even sometimes for not following their doctor's orders. I mean, it was really absolutely outrageous what some of these more conservative prosecutors would do. I think that there is great concern that we will see much more of that happen. We certainly saw it in Texas around their 6-week ban already. And the good news is there's some terrific resources out there. There's an organization called If, When, How that has a tremendous amount of resources about what your legal rights are, letting people know, first of all, if you have, for instance, if you've utilized medication abortion, if you go to the healthcare provider, if you go to the hospital, you go because you just want to make sure it was completed, you don't have to tell them what you took, because guess what? It doesn't stay in your bloodstream. You don't have to give up information that you think could be used against you. I think if you have relationships with healthcare institutions, healthcare providers, other healthcare professional associations that you can speak to, they need to understand that it is absolutely not the job of healthcare providers to turn people over to the police. That is the single one of that, and neighbors who have been nosy are the 2 ways that people have been turned in. And that is where we need to make sure that we are supporting people in this situation and pointing them to the resources so they can make the best calculated determinations for themselves about what's the risk, what's the risk calculus, how do I make sure if someone does get prosecuted, if they are being investigated, they absolutely need to look at If, When, How. There's also a defense fund, a legal defense fund that they've set up, and they have an incredible team of volunteer lawyers all across the country that will help with these kinds of cases. So I do fear that we are going to see more of those prosecutions, but I also think we have never been more equipped and more aware of it. And I do think that's really critical, is the raising the awareness, because when this stuff happens and nobody knows about it, and these folks are convinced to take a plea so that they can just get out of the situation.
Yeah, right.
That's when the problem happens. But if it's public, and they turn for resources, and then if it needs to be public, that's when these cases are dismissed. That's when these cases go away.
Yeah, I just want to add one thing to what Andrea is saying. The criminalization of women's private healthcare choices is a real danger. If you are a person, for example, on public assistance, and you have a criminal conviction, you can lose your right to public assistance. You can lose your other children because it's termed child abuse. So this is a real danger. The other thing is, it's not just abortion regulation and abortion criminalization, but it's this language that the anti-choice folks are using of the preborn, and legislation around the United States to give rights to the preborn. So
to the fetus, they're making the fetus
so then the fetus
person.
becomes a person with rights. So the fetus can be claimed as a tax deduction. There's legislation, all of this to create the fetus having more rights than and literally this is the language that is used, than the host. And so all of that is really, really dangerous, as you can imagine, because then it's murder. It's infanticide. You can't kill something. The host can't kill. But the other thing that it does for women is that it allows this increasing deprivation of privacy. And we start to see this language about the preborn being used to regulate women's ability to just live their lives. So.
Absolutely. Angela, do you want to read out the question about the bill that was introduced by Lindsey Graham? Because I think that
really important one.
Talk about that. Yeah.
Yeah. Okay. We have a question from Karen Frankenstein. She says, Senator Lindsey Graham of South Carolina introduced legislation in Congress today that would institute a federal ban on abortions after 15 weeks of pregnancy. Is there a way for us to mobilize to pressure the Senate to stop this bill before it even gets a vote? How will this affect the current state laws that still protect women?
Such an important question. Look, this is clearly an attempt by the Republicans in leadership in the Senate to try to figure out a way to wedge this thing and start to roll back the damage that has been done to their candidates who are so extreme on this issue.
Mhm.
The fact is that we have to be strong on this. We have to contact every senator that you know, every senator that you have, that you can vote for. Make sure that you tell everyone you know, this is outrageous. This is not about like some middle ground or some compromise. The reality is more than 90% of abortions happen before 15 weeks in this country. But two things, those who need abortions later than 15 weeks need abortions later than 15 weeks, full stop.
Yeah, exactly.
And second, what's happening in this country with the abortion bans at the state means that people trying to get abortion care earlier are being pushed later and later and later. So that would mean that a 15-week ban would mean many, many, many women would not be able to get abortion care. And it would create an incredible conflict with the 17 states and the District of Columbia that protected abortion rights. There would be like constant conflict over what would happen in those states and whether they would have to impose that 15-week ban. And it would mean, you know, again, and the flip side, it would be like, okay, so now you've got a 15-week ban on top of a full ban in, you know, Mississippi. You know, it was like, so there's an absurdity to it as well. The fact is, it's a pernicious, cynical attempt to try to avoid the fact and sort of obscure the fact that the vast majority of people who are running as Republicans right now want abortion to be banned outright. And they're just scared because, and they're scrubbing. I mean, I'm sure you've seen the stories. They're scrubbing their websites of like their previous statements. They're, you know, they're walking back what they've said, but they're not saying they don't agree with it. They're just saying, oh, well, you know, I didn't mean it quite that much.
Well, it's really dangerous because in addition to everything you said, there may be Democratic senators who agree with that.
That's right.
Who for the
Very
moment
strongly, it's not okay.
haven't, excuse the term, come out of the closet because they don't have to. But as it appears as it's a red herring that makes it look reasonable. And it makes it look like they're overturning the decision in Dobbs, which was a 15-week ban in Mississippi. Right. So let's remember the procedure. To get on the floor for a vote, it has to get out of the committee. So we have to write to the committee members and Chuck Schumer and make sure it doesn't get out of the committee. And then we have to do our work. And I will be spearheading that effort with my group. So if you want to help, send me an email and I'll give you the Zoom contact info for our next call. But yeah, Karen, thanks for asking that question. It's terrible. But, you know, they've been saying that for they were going to ban it. And I bet Graham is thinking he's so clever. You know, he's just so clever at screwing us over again, you know.
I mean, let's remember he represents a state where the state legislature was fighting and finally ended up at loggerheads over whether their full ban on abortion should have an exception for rape or incest or not. Right?
Yeah,
That's where they are. So that's the state he's representing right now, is a legislature doing that, which is really where he is too.
Let's see. We have at least a few more minutes. Angela, do you want to ask a few more questions, or don't we have a few?
No,
more minutes?
we have a few more minutes and we have a few more questions, but I'd like to ask this last one first, because I'm sure there's a lot of people that would like to know, how can we watch this film outside of the US? Yeah, Trapped.
Yeah, I'm sorry, I have to find that out. Trapped aired nationwide on PBS in America. I believe it's on Amazon Prime now. And so it's accessible there and it's not geo-blocked.
Okay, good. Then we can watch it. Thanks.
So it should be accessible.
And do you know, Dawn, offhand, I'm sorry to put you on the spot like this, if we can buy it and show it to groups?
I do know that you can, and if you have an educational screening request, ROCO Films, ROCO, represents the films, and we do for a pretty modest license that covers the shipping and handling. You know, and there's also there are other resources like about abortion laws, etc. And you can organize a group screening, and ROCO Films can make that available for you. And Sally, I will get that information to you
Thank you.
and so that you can share it with groups. So if people wanted to do a group screening, that would be great.
Yeah, I just wanted to get that out there. Thanks, thanks, Dawn.
All right.
Back to you, Angela.
The next question is from Monica. It's a question for both speakers. In your experience, what narrative is the most effective for anti-choice legislators to move on abortion rights? Are life or death, e.g. ectopic pregnancy stories, useful? I worry that sharing these personal stories is akin to asking permission to make personal health care decisions. Nobody has to explain why they need a kidney transplant or other medical procedure. Is it perhaps better in the long term to insist on privacy and autonomy?
I'll start.
You go, Dawn. You start and I'll pick up.
It's a sad response, Monica. I'm so glad that you asked this question, because I think in your question is some optimism that the opposition to abortion rights is sincerely held. And unfortunately, that's not the case. We see many, and I can tell you, I saw many people who publicly stated their opposition to abortion and privately accessed the service for their family members when they had need for whatever reason. There's no reason that's an appropriate abortion. It's your decision. What we have found is it is not tenable. It's not very likely that any stated anti-choice legislator is going to change their opinion, even when confronted with facts. We absolutely know that women are in life or death situations, and those stories, there's one legislator, and maybe Andrea will remember who this is, who professed dire concern at his vote to outlaw abortion and then voted again just recently for another abortion restriction. So we're not aiming at the people who are against rights. The stories, the narratives that we are aiming folks at, and I don't want anybody to feel that they have to share a story that they're not ready to share. That is a completely personal decision. But where people are willing to share, we have found that it does move the needle, mostly with people who are otherwise not thinking about the extension of circumstances in which an abortion might be necessary. There has been a very influential story, a very brave, courageous family that came forward with the story of their fetus that was going to die at birth, the fetus that did not have a skull. And this family went and had a press conference and said, she is being forced to carry this pregnancy to term. Can you imagine the horror of knowing that your baby will not survive, but you're going to be forced to give birth to a non-viable fetus, and then have that fetus suffer after birth when there is an option to terminate the pregnancy and allow the family to grieve in private and move on with their lives, instead of having several months of knowing that this impending horror is about to happen. So the stories that people are telling are really aimed at the silent middle. There are the vocal advocates, there's the silent middle, and then there are the anti-choice people who are at least anti-choice in private. So thank you for that question. But I've seen this over and over and over, and I don't know, Andrea, if you want to add to that as well.
No, I mean, Dawn, I just want to underscore a million times what you said. I think that's absolutely true. And I would say the only thing I would add is I do think that, to me, what is powerful is for people who do feel they can share their stories. What's important is for people to know that there are so many different circumstances, that it is not one singular circumstance that is sort of a good abortion or the right kind of abortion or the right reason. I think the more that we normalize that abortion is a part of your reproductive health journey, that is, and your reproductive life, I think that is important. And so the sort of multiplicity of stories, the fact that you do have those kinds of really heart-wrenching stories, and you have the stories that might be like, oh yeah, that kind of sounds like my circumstance, that I think it's about giving people something to connect to and to understand it's a multiplicity, that there are so many different experiences, and all of them are valid, and all of the reasons at the end of the day should be you trust the person who's pregnant to make that decision, because they know best for themselves and their families, and that should be the answer, full stop.
Just so you know, our group recorded videos of women who did tell their stories, and it's on a YouTube channel. I'm not sure how much traffic we're getting, but if you'd like to have a look, Angela will type it, I hope, into the chat room, because she was instrumental in getting this project off the ground and typing in the line that says, go get yourself registered and vote. In any event, I wanted you to know that we're working on that. Back to you, Anne. Thank you so much, Dawn and Andrea. It's been my pleasure and honor to meet you, even if it's over a computer screen. Perhaps we'll get to meet in person someday. And I can't thank you enough for all you're doing for the cause. Anne, back to you.
Okay. And I thank you, Sally, and everybody. Thank you so much for having this, Connie, for setting this up for us. It's so important. Thank you, Dawn and Andrea. I have so many ideas. I've been taking notes the whole time, and I think that film screening is a really good idea for us. And thanks to all of you who have joined us on this call today. I have a really important message for you. I would like to invite you now, any of you who might have questions about your ballot, how to vote down ballot, for example, how to do it. We have just for you today, one of our wonderful volunteers in a voter's assistance Zoom meeting, and you can ask your questions by following the link that Angela is going to put in the chat box for us. So our volunteers are standing by right now to help you. And speaking of volunteers, in closing, I'd like, yep.
Can I just ask, Anne, I think that you might need to put, Angela, you might need to put that in the Q&A, because I'm not sure everyone can see the chat. I think
okay, right. Angela, yeah, I think we need to go to that's a good point, Andrea, thank you. I hope we haven't been wasting our links putting it, so I have a lot.
I think they can see the chat, but I don't think they can do anything.
Okay, they'll need to be able to access
it, but I'll try to put it in the Q&A if I can.
Okay, all right. So in closing, I'd like to give a big shout out to all of the volunteers. There's so many, you know, in front of the camera and behind the scenes to put together all these things. And I'd like you all to know that all of our Democrats Abroad teams would love to have your help. So please consider stepping up to volunteer. And Angela will try to put that in the chat box if possible. We really need help with phone banking. That's a really important project, and it's not hard. It's calling members who want to be reminded, and there'll be links for that. The very important link that you might want for more ideas on ways large, medium, and small that you can help us get out the vote. You can check out our Women's Caucus GOTV Toolkit for members. Angela, I don't know if you can put that link in the chat box. That'd be great too. She's doing all of this work. And yeah, of course, remember that our overseas ballots are coming out right away, so you can request yours. The most important link to have is votefromabroad.org. Almost all of your questions will be answered simply by going there. It's a beautiful, beautiful tool. If you have any questions and you don't have time to join our Zoom right now to ask those questions, you can go to our frequently asked questions page by going to votefromabroad.org. So with that, I'll say goodbye for now. I'll see you in the voter assistance room. Andrea and Dawn, thank you so much for being with us today. I think you can tell it's a really important issue, and we're all going to be crossing our fingers and working as hard as we can. So thank you so much.
Thanks so much for having us.
Thank you.
Thanks to all of you. Bye-bye.
Thank you, Sally, for all your work.
Thank you.
Bye.